Hello, welcome to our bi-weekly talk show. OC, Your Health Matters OC. I get so excited because I can guarantee you the topic tonight is really, really important, as well as a tearjerker as well. So please make sure you have tissue close by. So this is Clayton Chow, Dr. Clayton Chow, and with Dr. Regina CK. Say hello, CK.
Hi. Hi, everyone. Good evening. Welcome.
Before we introduce you to our guest tonight, who's going to be speaking on the topic of water safety and drowning prevention, let's get an update on COVID from CK. Go ahead, CK.
So unfortunately, our numbers continue to rise. Our case numbers have increased to 18.3 per 100,000, which is still a gross underestimate of the actual number of cases out there, because we know that many people are still testing at home or maybe not testing at all. Our positivity rate has also increased, and our hospitalizations, now we have 131 in the hospital with COVID and 20 in the ICU. And the majority of those who are in the hospital are still ones who are not fully vaccinated and not boosted. So we really encourage everybody to really get up to date with their vaccines, especially if they're eligible for a booster or even a second booster. And as far as our vaccination status, we're slowly improving. For our 5 to 11-year-olds, we do have 34% who are now fully vaccinated. For our 12 to 17-year-olds, 68% are now fully vaccinated. And our 65 and older population still does well, with over 95% fully vaccinated. So again, please, if you're out there not fully vaccinated or not boosted, please talk to your primary care provider, get your questions answered, and consider getting boosted, because it's one of the most important ways of protecting yourself. That being said, I am still wearing a mask because with these high transmission rates, it's the other thing that we can do to protect ourselves from getting sick, because we do know that the variants that are circulating in Orange County are escaping some of our immunity that we may have built from previous infections or even from the vaccines. And so it's, again, still very important for everyone to use all the different protective measures that they can to prevent illness. And that being said, so what do you do then if you develop COVID symptoms? Whether or not you're vaccinated, first isolate, get tested, call your provider, and notify your close contacts that you may have COVID. And then you can, typically, if you're not able to test, we want you to stay home for the full 10 days. If you're able to test, so an antigen test kit, you can test at home after 5 days to see if you test negative. If your at-home test is negative, 5 days or after from the first onset of symptoms, you could actually end your isolation sooner than 10 days, but you must wear a mask when you're out and about to just protect others from getting sick from you. And if you have any high-risk conditions, and there's many, we're going to pop up a slide, you should contact your provider as soon as possible, because you may actually qualify for treatments. And there are so many more COVID therapeutics that are available now out in the market, including 2 oral antiviral pills, as well as IV medications that can be given to you in a hospital or an infusion center. But that does require that you talk to a healthcare provider to be considered for those treatments. So I'll highlight some conditions that actually put you at high risk, no matter what your vaccination status is at this point. Age, if you're over 65, even if you don't have chronic conditions, you actually are eligible for a therapeutic. Chronic kidney disease, chronic lung disease, if you're overweight or obese, which is a lot of our population, if you're inactive, you're pregnant, if you were a previous smoker, a current smoker, if you have a substance use disorder, if you have mental health conditions, if you have neurologic conditions, those all qualify you to be high risk for developing severe illness. So again, please contact a clinician for consideration of treatment.
I think at this point, and without sounding like a broken record, I got this question all the time: is when should I wear a mask and what have you? And you've heard us from the very beginning in advising you to really assess your own risk and do what is appropriate for you, right? So if you are someone who are high risk, having those conditions that Dr. CK just mentioned, or you live with somebody who are high risk, you got to protect yourself and you got to protect your loved one, right? So if you are in a crowded area, indoor, outdoor, or if you are indoor with a group of folks that you don't know their vaccine status, then just assess your own risk and do the appropriate thing for yourself. I mean, this is a multi-layer approach to protecting yourself, your loved one, in the community, right? Wearing a mask, get vaccinated, and get boosted if you are eligible. And I still stand behind it. The only way that we can get out of this pandemic and protect yourself and live with this endemic eventually when we get there is really doing the right thing and get vaccinated and get boosted, right? We're going to have to learn to live with this as a community. And so it's now is about, protecting you and protecting your loved one and doing the right thing. We still see people who get hospitalized because they are not fully vaccinated, or they have chronic health condition but have not had a chance to get the booster yet. And so we've seen people who get infected that way. And so there should be no doubt that the vaccine works. And I always say this, we live in a country where vaccine is readily available, and it is unfortunate if people still have barrier or decision not to get vaccinated because of one reason or other. Other countries still suffering from not having enough vaccine because of, their economic situation would not allow that country to have access to all of the vaccines available, or the infrastructure of the country would not allow them to distribute vaccine to all of their citizens. So there's a global effort to do this, but we live in a country where we have the availability of vaccine, so I would encourage you to do so. Cases are growing up, as you know, and the number that CK gave you are number of the labs that got reported to the system, but we do know that there are people who are utilizing the self-antigen test, but those results do not get reported to the system, so the number is not a true reflection of what's happening in the community. Right? We don't mean to sound a big alarm, but that's what's happening right now. And as we are entering into summer, people are more outdoor, hopefully, are in crowded area, that they are paying attention to the risk that they put themselves into and make that assessment and do the right thing for you.
If you look at the rates, actually, a CDC COVID tracker does have a community level, and over the last between last week and this week, we did enter into what we call medium community level. So that does mean even CDC is recommending we layer up on protective measures to prevent ourselves from getting sick.
And there's this myth that there's a shortage of these medications
Right.
that CK mentioned to you. There's no shortage. They are available.
Right.
You just need to contact your primary care physician or get to a community clinic or urgent care to see whether or not, when you are tested positive for COVID, that you qualify for these medications, because the goal of these medications is to prevent the progression of the disease, the severity of the disease. And it's important to do that because you probably heard us talk about long COVID syndrome or long syndrome. We want to prevent that. At least 1 in 4 suffer from long syndrome, and we want to be able to prevent that. And then secondly, these treatments prevent hospitalization. So that's the reason why we really ask you that if you tested positive, you need to talk to your family. So now let's talk to the topic of the day. As we mentioned, summer's coming. More people, because of the weather, will get into the pools and get into the ocean. Orange County enjoy 17 miles long of coastline, beautiful coastline with just really nice water when the summer comes. And then if you fly over Orange County, it always amazes me that most of Orange County, if you look down from the airplane, almost everybody have a swimming pool in their house. I think we live in a county with more swimming pools than anyone else, but our expert will tell me that I'm wrong. But so with that, our subject matter expert tonight to talk about the topic of water safety and drowning preventions are Kelly Solmentoro. I want to make sure that I don't butcher your last name. And Julie Lopiccolo. Perfect. All right. So let's go to, well, just say hi first to the audience, please. Kelly and Julie, say hi.
Hi, it's so great to be here.
Yeah.
Hi, we're so happy to be here talking to you today about water safety. Thank you for having us.
So, Kelly, tell us about the statistic around drowning and what have you.
Sure. Well, first off, I just want to thank you for dedicating this show to water safety. It's timely, it's important, and as we enter summer, it's also important to realize that we're entering the season with the highest incidence of drowning here in Orange County and throughout the nation as well. So who's most at risk? Children 1 through 4, drowning is the leading cause of death, tragically. And moreover, numerous children are also, who experience near drownings suffer lifelong disabilities. So it's tragic all around. So children under 1 to 4 most at risk. We know that children are most likely to drown in pools. About 9 out of every drowning among this age group is in a pool. 44% of those is in backyard pools, and 47% of those are in community pools or spas. So they're happening in pools. Aside from that, you're going to see that last 9-10ish% in open water, bathtubs, fountains, even dog bowls. Anywhere there's water, children can drown. There's a risk. And it's also important to realize that anywhere there is water, we also have risk. But the good news is there are things we can do to prevent drowning.
What about the statistic in older adults?
Yes, thank you for asking. So the risk doesn't end once your child turns 5. So first, before talking about older adults, older kids are also at risk. We know that older kids are going to be more likely to drown in open water. So here in Orange County, that's probably going to be oceans. It is oceans. And in fact, as children get older, their risk for drowning in pools starts to decrease, but the risk for drowning in open water starts to increase. So you have, it's called an X effect.
Thank you. Thank you.
So back to older adults, so older adults are also at risk. Any guess on why this might be? Anyone?
They
Older adults.
go
I know, so
swim.
I can't guess.
they go into the water by themselves, or?
Yeah, exactly. So older adults are also at risk for drowning. So some situational factors might be that they are swimming alone without a buddy. There might be predisposing medical conditions or an event such as a stroke or heart attack, intoxication. People might be drinking and swimming, and also underestimating fitness levels and swimming ability, for example, in the ocean, surfing ability, swimming ability, ability to navigate waves. So those are going to be some factors with older adults. And what do the stats say? So the older adults are the age group who are most likely to experience fatalities due to drowning. So if we look at some data, we refer to our partners over at the Orange County Fire Authority for drowning statistics. And in 2020, the 1 to 4 age group and the over 50 age group experienced about the same number of incidents of drowning, 27 and 28. However, in the young age group, in the 1 to 4, 3 of those were fatalities, whereas in the older age group, 18 were fatalities. So older adults are more likely to die if they're experiencing a drowning event, tragically.
You know, I forgot to ask you, who do you work for, Kelly?
Oh.
We forgot to introduce who you work for.
I work for the Orange County Healthcare Agency. I am in the Health Promotion and Community Planning Division, and I oversee our injury prevention program. Aside from that, I'm a proud member of our Drowning Prevention Task Force with our guest, Julie, here.
So Julie is a family member. Julie, before we get to your story, let's take a break now to to look at one of the public service announcements that you and your husband have created for the community. Pull out your tissue, folks. So let's take a look.
Every morning.
He's always happy.
He never cried.
If I would come
woke
in,
up
he'd
and
ask
talked.
for Dad. If Dad came in, he'd ask for me. He was cool.
It was very cool.
Thank you. Sorry. Welcome back to Your Health Matter OC. This is our show on the topic of water safety and drowning preventions. If you have any questions during our show, please send an email to yourhealthmatters@ochca.com. Again, yourhealthmatters@ochca.com. Julie, when I first saw this PSA over the weekend, I was just a mess. If you're comfortable, please share your story.
Yes, thank you very much. Did you want? I'll just take a brief moment to introduce myself.
Yes.
My name's Julie Lopiccolo. I, along with my husband Jonathan St. Clair, who you saw in the PSA, founded the Jasper A Foundation after the drowning death of our 21-month-old son, Jasper. I did not set out to be a water safety expert. This happened. I'm an attorney, and I did not choose to be doing this, but in March of 2014, I received a call at work. It was a Wednesday around 10 a.m., and this is very clear in my memory. I have such a clear memory of that day. The caller that called me couldn't, or wouldn't tell me what had happened, but informed me that my son was taken in an ambulance to Chalk Hospital. And I remember flying out of my office, down the stairs, into my car. I work in Orange, so I was nearby, thank goodness, because I was not driving safely there. And on the way, I called my babysitter, who was with my son one day a week. My mother watched him the other two. I worked part-time at the time. And she answered the phone, and she was hysterical. I couldn't immediately understand what had happened. And I hear her say, "I found him in the pool." And I started screaming at her, "What pool? What pool? What are you talking about?" I thought it was a blow-up pool in my backyard. I don't have a pool in my yard. And as I was screaming, I realized that she had taken him to her house. She lived around the block from us. She was 19 years old, and I had talked to her about never bringing him to her home because she did have a pool in her backyard, and there was not an isolation fence around it. So I knew in that moment that I would never see my son alive again. I knew. So what happened that day, my babysitter did take my son to her house, and he was 21 months old, and he was a very curious, smart toddler. And we know that children get away from us so quickly. Just look away for a moment. We think that she was using the restroom and couldn't find him when she came out of the restroom. She did not check the water first. She checked the house. She looked under beds, in the closets, all over the home. We don't know how many minutes it took her before she realized there was an open door in one of the bedrooms leading out to the pool, and she found him in the pool. She did no CPR, but she panicked. She wasn't able to administer CPR. So he, luckily, and this is probably the reason he was revived at Chalk, her grandfather lived next door, and he was a retired firefighter, so he came over and was able to administer CPR until paramedics arrived. He was taken to Chalk, and he lived for a week, but he did not survive his brain injuries. So I want to when I talk about the incident, and I try to provide detail, not only because it's really clear to me, but I think about all the things that went wrong that day, and the things that I know now, and how I could share those things with parents to make sure that their children are protected. So One of the things I didn't know then that I know now is that the law actually requires isolation fencing. So all residential homes do have to have isolation fencing. They should have actually 2 drowning prevention features. That was a law that we helped work on to up the requirement of 1 drowning prevention feature to 2. So current California law actually requires 2 drowning prevention features in your backyard for residential pools and spas. And number 2, swim lessons save lives. My son was not in swim lessons. He was only 21 months old. I don't know that he would have been a proficient swimmer if he had been in swim lessons, but you can start your children in swim lessons, the AAP says, as early as 1 year old. And children in early swim lessons, they recognize that water is dangerous. Jasper did not understand that. He thought that water was fun. Every child that's been in swim lessons understands they can't breathe under the water, and there's an opportunity for you to engage with your children on that topic. And studies show that children in former lessons are 88% less likely to drown. So the number one thing you could do to protect your child is enroll them in swim lessons. Involve your children. So my husband and I have been blessed to have 2 children since Jasper died. They're 3 and 6 now. And we have a water safety briefing before we swim. They are excellent swimmers. The 3-year-old, he's almost 4. He's not as excellent as the 6-year-old. But we have a water safety briefing every time we go swimming, whether it's the beach or the ocean. We talk about the rules. We talk about not going into the water alone. When we get out of the pool to have lunch, we say, pool's closed, gates closed. You know, older cousins can't let you in. We engage them in water safety. We're at the beach. We talk about the rules of the ocean, swimming in front of a lifeguard. Having that briefing with your kids, involving them in water safety is so important. I didn't do that. I know now that wherever there is water, there is risk. So the way that we can protect our families is to try to identify what the risk in our life is. So for me, that risk was that pool at my neighbor's house that I knew that my babysitter had access to. I should have spoken to her about it. I should have made sure that she understood. Really, I did tell her not to go there, but it was not a constant conversation. We didn't talk about drowning being the leading cause of death. She wasn't as aware. I wasn't as aware. You really have to identify where that risk in your life is and see what you could do to minimize it. So it can happen to you. I have met so many families since the time that Jasper died. In every possible scenario that you can think of, all different ages, good parents. These are good people and good parents who love their children. And drowning is the leading cause of death for children 1 to 5. There are hundreds of drowning deaths in California every year. There are over 1,000 emergency room visits due to drowning. It is a very real problem, and it can happen to you. Learn CPR, practice it, be very active in your supervision. I did say that my children are great swimmers. I get in the water with them. My 4-year-old is still at the level that I practice touch supervision with him. I am in the water with him. He is too, you can't, with the younger children, you can't sit on the sidelines with them. You need to be on the steps, right near them, where you can grab them if they need help. And I really want to remind people that drowning, especially with children, is absolutely silent. We do not see the distress signs that adults exhibit when they are drowning. Children fall into the water, and it is silent, and it only takes seconds. In the time it would take you to send a text message or go answer the door, your child can drown.
That's so important message, because I think many people, many parents think that as long as I give my child a swimming lessons that they're okay in the pool by themselves. And sometimes you hear children fighting, I'm okay, Mom, you hear it all the time. I'm okay, and they don't want the parents around. Yeah. And so insisting that the adults have to be there, it is so, so important.
I will tell you that my children ask permission to get into the bathtub every night. My 6-year-old, every night still, Mom, may I please get in? They do not, I have drilled it into them. You do not get into water without permission. Any water, at any time. And we could just, one of the things that we could do to just keep that conversation going with our children, engage and involve our children in water safety.
Yeah. Kelly, so what do we do? What does the county health promotion program do as related to drowning?
Yeah, well, before I go into that, can I thank Julie?
Yeah.
Julie,
yes,
I want to thank you from the bottom of my heart. As much as I wish I didn't know you, because it would mean Jasper would still be with us, I am so glad that I do. I am so glad that you are part of the drowning prevention community. You challenge us as professionals and as institutions to do more and do better. And I know that together we're saving lives. And I believe it. Thank you. So what are we doing? We're doing some great things. So as a local health department, there are a variety of things we do across the service areas, across the divisions, to make sure pools are safe, to get messaging to our residents and our clients that they can be safe in the water, and empower them with tools and resources and knowledge to do that. So first off, in our environmental health division, these are the professionals that go out and make sure pool environments are safe. They do inspections, unannounced inspections to public pools to make sure that everything is in compliance, that there are no violations, that the water quality is safe, that the gates are functioning. Rescue equipment is on site in case there is a need for rescuing. They oversee the plan check process, where if people are building new pools or renovating pools, they make sure that that's done according to certain codes and regulations. They conduct inspections mid-construction, and once that's all finished, to make sure everything is up to code. They also have the enforcement arm. So hopefully, ideally, everything works just fine through education and regulations. But if there is a need for enforcement, they are the ones who go out there and make sure that public pool operators are meeting the requirements and regulations that they are required to meet. And I should mention that they are responsible for, in a neighborhood of 7,000 public pools. So they are really out there making sure that all of our residents are safe and able to enjoy those pools throughout the summer and throughout the year. And throughout all of this, they provide education. It's not just enforcement, it's not just inspections, but they do education. They teach pool operators and owners how to be safe, how to get education to their clients and customers and so forth. Okay, and let's see, public health nursing. So community and nursing services division. These are the nurses who are out there in the homes. Through their home visitation programs, they have the perfect opportunity to see what is happening in the home. How old are the children? Are they at risk for drowning? Is there a pool? Is the gate being propped open in the pool? They can provide real-time assessment and education to mitigate any risks that they find. They reinforce certain things like the importance of always having a water watcher when their children are swimming. Anything that they see, they can provide that education and refer to resources to help those families be even more safe. Okay. And then last but not least, I'm here today on behalf of the Health Promotion and Community Planning Division. And we're the ones who do community education. We're health educators. We provide messaging and education and all that fun stuff. So throughout May, which was Water Safety Month, we have been working with our communications team to get messaging out there, to let people know about water safety, things that they can do. Almost every day in May, we've had social media posts on Facebook and Twitter, getting messaging out there about drowning prevention. We've had a PSA that's out there as well. We've taken advantage of any digital platforms we have, newsletters, website content, to also push messaging out there as well. And also it's important to emphasize that we don't go at this work alone. Everything we do is on behalf of and in partnership with our drowning prevention community, specifically our Drowning Prevention Task Force, which I know we'll be talking about in a little bit.
Well, let's take a break now and show the public a video on drowning prevention that is part of a campaign supported by the healthcare agency assume that your team
Yes.
and the Drowning
task
Prevention
force.
Task Force to educate our Orange County residents on the importance of prevention actions. Do everything that we can take. So let's take a look.
Drowning is the leading cause of accidental death for kids under 5. It only takes seconds to drown, and the impact would be devastating. Please always watch your child around water. Learn CPR and basic water rescue skills. It just may save a life. Visit us at drowningpreventionoc.org to learn more.
Hello, you're watching Your Health Matter OC. Today, the topic is about drowning prevention and water safety. If you have a question, please send us an email to yourhealthmatters@ochca.com. CK, as a primary care physician, I know, physicians are supposed to assess a child annually, and I don't remember whether or not part of that assessment is asking parents about, the water safety, the drowning. Especially we live in Southern California, surrounded by waters and what have you.
Typically, there's so much to talk about at a well child visit, and so sometimes, depending on the situation, if I learned that a family does have a pool, then I'll spend some extra time.
But how would you learn if you don't
exactly
ask?
If you don't ask, you don't know.
Yeah.
Or the other question is, the summer's coming up. Do you have anything exciting for your child? Are they enrolled in classes? And then we get into that discussion. But it's up to the primary care provider and what they want to focus on, because there's just a laundry list of things. And so sometimes we just send the parents home with this checklist of, if I didn't discuss something today, please look at this checklist to make sure your child's safe. So I think it depends. I don't know that everybody goes over water safety. I don't remember that with my children's pediatricians, but because there's so many things to talk about in that 30 minutes.
Yeah. So Julie, thank you so much for sharing that painful story with us. I can tell you, Jasper was a beautiful boy, as you all could see in the picture. What a life lost. But
Thank you.
I was just thinking in my head, well, whose responsibility is it to educate a young parent, professional parents, as well as babysitter, that these are the important things, right?
Yeah.
And I'm thinking, well, the school is, but by the time they get to the school, that's beyond age 4. What happened to the younger kid?
Yeah.
Tell us what is the purpose of the Jasper Ray Foundation? How do people get in touch with you?
Sure.
And what would be your recommendation from a community prevention perspective?
Sure. So our organization is based in Orange County, and we provide community education and resources to parents, and really our focus is parents and caregivers because of the way that Jasper drowned. And we've historically, our partnership has been with other parent groups, community groups, and we've also worked extensively with the pool service industry. We've had a lot of partnerships with pool service repair providers and pool builders to get the information, because we know that their customers have pools in their backyard and they have a wonderful opportunity to provide the information. So we've delivered, thousands of Water Watcher tags through that partnership. We've also partnered with realtors to get information to homes when there's a home being transferred with a pool. They again have an opportunity for this education. So there's a lot of different stakeholders involved. The Jasper Ray Foundation, we partner with other organizations. Currently, I'm sitting on the board of the newly formed California Water Safety Coalition, which has been formed to be an umbrella organization for stakeholders and drowning prevention organizations all throughout the state. And I want to read our mission. We want to lead statewide strategy in the development, implementation, and evolution of water safety policy. Our mission is to reduce the rate and burden of drowning and aquatic injuries in California through intentional collaboration across age, developmental spectrum, bodies of water, activities, and California geography. There's lots of different water in California. We're partnering with our friends in Northern California who are also concerned about open water, canals, things like that. We're trying to shore up communication and collaboration, because at this time, it's not given the public and government support that it deserves. It's an epidemic, it's a public health crisis, and it should be treated as such, but there just isn't the funding. It is not seen that way at the state and national level. So USA Water Safety has convened a panel of experts, and I'm co-chairing with another person and a group of experts, the Barriers, Electrocution, and Drain Entrapment Working Group. And there are 5 focus areas. And the National Water Safety Action Plan is being developed. It's a evidence-based plan that's going to provide recommendations that can be implemented in jurisdictions that's going to address what can physicians do? There is legislation in other parts of the country that require physicians to address this, require it to ask, does a child have they had swimming lessons? And if not, they basically prescribe swimming lessons for a young child. So these kinds of things, if we know about them, can be models that can be implemented in other jurisdictions. So this has been a very long and arduous process. Right now it's being reviewed by an outside panel of experts, a blue ribbon panel that's looking at the recommendations, and it's going to be a comprehensive water safety plan. The United States doesn't have one. It'll be our first. Other states have one, and the World Health Organization has recommended the best way to combat drowning is to have a National Water Safety Action Plan, and the California Water Safety Coalition is in part set up to implement that plan in California. So it's a really exciting time for drowning prevention, because there does need to be a shift. There does need to be a change. The needle has not moved. The numbers are not going down, even though we know all the things that we know about how to prevent it. 100% preventable loss of life.
But so that's the policy level. From a practical level, right? I'm thinking, does every pool cleaning business required to talk to their customer about drowning prevention? If I go to the city and said I want to have a license to be a pool cleaner, does the city require that, okay, if you want to have this license to conduct this business, this is what you have to do, right? So that's one question. The other thing is, I go to Lowe's and Home Depots all the time, and each of those businesses have a sections on pool supply. Mm-hmm. I don't think I've seen them post any drowning prevention material in that section. Yeah. Maybe that's something that we could get them on board and say, hey, in this section that you are selling pool supplies, maybe we have a poster on drowning prevention post right there for the public to see. Think that is concrete. Any entity, any business that sell pool supplies should have material on drowning prevention. Do they exist? I don't know. Do they?
I don't know. That's a great idea. And we did try something like that a few years back. We provided some educational materials to pool stores, like pool supply stores.
Pool supplies. Mm-hmm.
Yeah. And we had water watcher tags, which I'll talk about later, water watcher tags made available on the counter for any family with some education about what they are and how to use them. I think that's a great idea, and I think we should revisit that again.
Yeah, we do. That's part of the partnerships that the Jasper Foundation has formed all throughout the county, and we have done things like that. It's a really great idea, and that goes to the point of all the different stakeholders that are involved, because if it with the status that it is now, not having the resources that say car seats had or bicycle helmets had, when it's viewed as a public health concern of that same magnitude, given the same resources and given the same resources as an issue like that would be given, then it's a trickle-down effect. But since it isn't, we really have to use our grassroots partnerships to make sure that we're getting information to the targeted audience from every angle. Mm-hmm. So, and to answer your question about the pool service providers and builders, they do have a very active lobbying organization. The pool and Hot Tub, PHTA, Pool and Hot Tub Alliance, they actually do wonderful work nationally with drowning prevention, and they're working with us on this plan to help us figure out how best to get the guys that they represent, it's mostly guys, there are some females in this work, the people that are building the pools and servicing the pools, how do we get that engaged in water safety? The community is engaged. There are CLE requirements, so continuing education requirements for things like inspectors and pool builders. So we can get at it from an education standpoint, but servicing a pool is not a licensed profession, so there isn't a licensing body. But you can still engage that group. There's ways to incentivize, using the market to incentivize the dissemination of information. Usually pool service providers get a referral fee for putting up a pool fence. So if they have the information and if there's a monetary value to them to be able to sell that pool fence and maintain that pool fence for their customers. And most of the people that I have talked to that are servicing these pools, they don't want to see a child die in one of their backyards. They know the family and they are committed to helping. So it's really just about getting them the resources and the information and asking for their help. And that just takes boots on the ground,
Yeah. Kelly, I'm thinking that maybe what we could do is create a pamphlet of some sort, or borrow pamphlet from that has been around and send it out to all the city manager and said, hey, summer's coming, can you push this out to your residents, right? I think that could be done.
Yeah.
But, big retail places like Walmart and Target, usually before summer come, they started to sell, I don't know, what do you call that, toy for kid to use in this pool. I don't see any material on drowning prevention in that section of the store. Maybe we should approach them just like we would approach Home Depot and Lowe's and said, put drowning prevention material right in the section where you sell pool supply. Just like Walmart and I mean, they attract a lot of kids. What do you call that? Those ball that you can play in the beach tube balls, on the beach. Yeah, something like that, right? In that section where they sell those material, they can put the material on drowning prevention. I think that could be something that we could do as a community.
Definitely.
I mean, easy, right?
Yeah.
And while we're waiting for this larger policy from the national and statewide level, what do you think? Is that something we can work together with Jasper Ray organization, foundation, as well as the Drowning Prevention Task Force?
Absolutely. I think anytime parents see education and have more knowledge, that the better choices they can make, while we're also waiting for the environment to get safer, for the legislation to also make us safer. It all fits together from all the different angles.
So before we get into, we have several questions from the audience, but let's take our last final break. And this break, we're going to show you a third video that is from our partnership with the Orange County Fire Authority regarding the ABC of drowning prevention, right? And this contains some great advice and simple steps that all of us could take to prevent the heartbreak of losing a loved one to drowning. So please take a look.
Hi, my name is Steve Concialdi. I'm a captain paramedic with the Orange County Fire Authority, and today we're talking about drowning. Drowning is the leading cause of death and injury for children under the age of 5. One drowning death is too many. All of these are preventable. Children are drawn to the water. They think that's playtime. They see their brothers and sisters playing in the water. They're used to mom and dad holding them, and they like to play in the bathtub. They don't see the danger or the potential consequences of jumping or falling into the water by themselves. Every second someone is underwater is critical. Irreversible brain damage happens within minutes. Here at the Orange County Fire Authority, we promote the ABCs of water safety. A is for active adult supervision, having a water watcher, someone who knows how to swim, that is watching the water at all times. B is for barriers, fences and gates that latch and self-close around all pools and spas. And C is for classes, Everybody should know how to swim, and adults should know how to perform CPR. Adults 50 years and older are the most at-risk age group for drowning and have the highest drowning incident death rate. The common theme with all adult drowning is that they are swimming alone. Medical emergencies can happen at any time. A stroke, a heart attack, low blood sugar, you become lightheaded or dizzy, and if nobody is with you, nobody can save you. The Orange County Fire Authority asks you to prevent drowning. Never swim alone, and always watch your child around the water.
Welcome back to Your Health Matters OC. Today we're talking about drowning preventions and water safety. Kelly, you mentioned something about the water challenge. You want to share with us what that is?
I would love to, yes. This is something that the task force took on. I'm so proud of this event. It's the Water Safety Challenge Day event that the task force has been putting on for the last several years. And the idea with this is all throughout Orange County on the same day, which was May 21st this year, cities, along with partners, were hosting Water Safety Challenge events. And what this is a fun opportunity for families to go learn about water safety, there's an in-water aspect where children are practicing certain water competency skills in the water, different stations that they go through. Parents can find out what their child's particular strengths are and what their needs are. What do they need to work on some more? Not only have I been pleased to promote this event, but I've been a participant for the last several years. I have a 6-year-old. We've been going to this event since she was 4, and it was eye-opening. I thought she was pretty good in the water until she jumped in, and I realized that she had some things to work on. We went back this year. She nailed the ball. Good job. She's watching right now. So, like I said, this was done throughout the county at 8 different locations. Some of them had in-water aspect to it, and others were on land only. So I'll talk about some of the stations that they went through. So on land, there were things like CPR, where the participants were practicing CPR, learning how to escape rip currents. This was at our beach location in Huntington Beach. Life vest fitting station, and also teaching about water watcher tags. And I have a prop for this one that I'd like to talk about.
All right.
Okay, well, first off, okay, one for each of you. This is a water watcher tag.
Thank you.
And what this is so this goes along with the concept of active supervision. When you have children in the pool, a myth is often that if there's many people, everybody's watching them. But if there's many people, usually nobody's watching them. It usually happens when everybody thinks that somebody's watching the children, or if nobody expects the children to be near the pool. And the idea with this is, say you're having a pool party. You designate somebody to be a water watcher. So I'm the first water watcher. I wear this tag for 15 minutes, and while I have it on, all I do is I watch the surface of the pool, under the pool, the perimeter of the pool. I make sure that everybody's safe. I don't look at my phone. I don't get a drink of water. I don't go inside to use the restroom. I watch the water. And I don't stop watching the water until I take this off and give it to my friend who's going to watch the water next.
Right.
And to really drive this point home, Dr. Chow, I've heard you're a good sport. So wear your water watcher tag.
All right.
And wear your water watcher hat.
I love that idea.
Thank you so much.
You're welcome.
This is great.
So yeah, also with the Water Safety Challenge, the coolest thing about this event is the in-pool stations. So children are learning real time what their water competency skills are. So they're doing things like jumping in the pool, making sure they can swim back to the side of the pool safely. They're treading water. They're floating on their back to make sure they can save themselves until rescue arrives. Reach, throw, don't go station. And what this is a lot of times, sometimes what can happen is if somebody is in the pool needing help, there can be a second victim. So somebody might jump into the pool thinking they're going to help that person, but what ends up happening, if they're not a strong swimmer, they become a second victim. So what you want to do instead is take something like a pool noodle, get down on the ground, reach it out, have the swimmer grab onto it and pull them back in. My 6-year-old, who's 40-ish pounds, was able to pull a full-size grown-up into the pool, to the side of the pool by that method.
And she's on her belly when she's doing it, so she can't get pulled in.
Right.
And an
Got it.
adult can be on one knee as well, so you don't get pulled in or on your belly.
Right.
Got it.
Yeah. So Julie, you've been doing the Water Safety Challenge as well for years.
Yeah.
How did it go for you?
Oh, we love it. It's so fun. This year, actually, we did at the Tustin location, we all put life vests on, me and my 2 kids, and we jumped in. We have a boat, so we all wear life vests, but my kids have never been off the boat because it's an ocean boat. They haven't been off the boat. They actually don't know what it's like to swim in a life vest. So we got in, we jumped, we practiced like going all the way to the end of the pool, like rolling over on our back, taking a break, like waving at the boat, and just sort of practicing what it felt like to be in a life vest because they've never actually experienced that. And then to make sure that it was fitting them right. If it's floating up on them, we know that maybe it's not the right size. So that was we had fun doing that at the challenge, yeah.
So we have several questions from the audience, and I think you kind of answered some of this throughout our conversation, but let me reread them. Question from Janice in Huntington Beach. When can my child start swimming or take swimming lessons? Where can I sign up for swim lessons? And does anyone offer free swim lessons in Orange County?
Okay. I'll take the age.
Sure.
Okay. Yeah. So, how young can a child start swimming lessons? We defer to the American Academy of Pediatrics, who say that as young as age 1 can a child start taking swimming lessons. One thing that's important to remember with this, though, is at that age, a child is not learning how to rescue themselves yet. They're learning how to develop a love of water. It's a bonding experience. They start to understand that there is risk with water, like you mentioned. They're starting to learn water competency, but not at that age can they yet rescue themselves. But absolutely start swimming as young as 1 year of age.
And can people get free lesson here in Orange County?
So our organization does do swim scholarships.
Okay.
We're expanding that program, and we're always raising money to do that. Also, make sure that you check your city programming. I know in the city of Orange, I live in the city of Orange. We have pool in the Hart Park pool. There's lessons, and then also Orca, Orange Regional Competitive Aquatics, provides lessons during the summer, and they are really affordable. And you can do a lot of lessons. They're 4 or 5 days a week, after school and even into the evenings. So the summer is a great time to get, if your child's not been in the water yet, to get them in the water. They also have parent and me classes. You can get in with your younger child. That helps with affordability. Those are generally group classes, so they're less expensive. But if anyone is in need, we do give need-based scholarships at our organization. So they can reach out to us for that.
And a question from Ron, how do you install fear and healthy respect for water in young children without causing them trauma, too much fear, so that they are afraid of the water?
So I will say that one of the major benefits of getting your children in lessons early, even if it's parent and me classes, which is what I did with my kids. I got in the water. I was so grateful to not have to get in the water with them at some point on Saturday mornings. But the parent and me classes, they're fun. And when you start with them really young, they really aren't ever afraid of the water. So, and people say, doesn't that increase their risk of drowning? It really doesn't, because in my opinion, in my view, I saw the way that my child that did not have any swim lessons responded to water, and he was drawn to it and had no idea of the risk, and my young children who understood the water. Every kid's personality is a little bit different, but if they don't have that fear, it's really fun. But it's up to the parents to teach them about the risks of drowning, and you should start doing that as young as possible.
Okay. And here's a question from Catherine. How do you remain cool-headed if you had to administer CPR on your own child in an emergency? And are there tools to help you plan that you will not panic?
I personally think for me the best thing is practice, practice, practice. If you know it, then you're gonna automatically do it. So you don't have to be certified in CPR. If you can get certified in CPR, if you regularly take care of children, it's a really good idea to get certified in CPR. But there are also like great YouTube videos out there. There's a lot of information just to remind yourself 2 breaths, 30 compressions. Empower yourself with that information. If it's natural to you, because you've practiced it, you're gonna respond.
Yeah, can I add something to that
Yes,
too?
ma'am.
I'm a big believer in visualization. So everything Julie said, but I also visualize it happening. So I visualize that I find my child in the pool, I pull her out, she's not breathing. I imagine what it smells like, what it feels like, how I respond, how I give those breaths, all the steps. And so if it happens, I'll think, I remember this, I know what this is like, and I'll do it. I've never had to, but I like to think that I'll be prepared.
And a question for Amanda, I think this is for you, Julie. Do you recommend asking every person who invites your kid to their home if they have a pool? How do you address the topic of an unprotected pool to ensure that your kids are safe?
So I understand that this is difficult. I know the statistics. I know so many families who have lost their child in a pool because there was no isolation fencing. It is also the law. If you're a homeowner, with my attorney hat on, you have a liability issue on your hands. So, just from that perspective, it's the law to have your pool protected from unintended access. But I understand that it's really hard to address it with friends and family. I have a lot of parents have told me, my mother-in-law watches the children and she won't put a fence up, but she watches my kids. I don't know what to do. You have to insist on it. The risk is too great. There is a way to do it in a kind way, but you need to be insistent about it. If you are able to, help them pay, if you have a caregiver that's taking care of your children, you might want to help them pay. It's not that expensive. Do some of the legwork for them. Mom, I found, or whoever it is that's taking care, I found a company that can install the fence for you. It's only X amount. I can, maybe we could split it with you. So think about options, but I believe, and I know this to be true, that children should not be cared for in homes with unprotected pools. If you're a visitor to a pool, I have a hard time visiting pools and having a good time at pools that are unprotected. But as a parent, it's really incumbent on me to make sure that my children are protected when I'm a visitor in a home.
So the lessons is you have to have an adult with a child at all time when they're near water, right?
Absolutely.
So I love this. I love this water watcher concept. This is so, so important.
It's so
and
simple.
you are so right when people think that there's so many people around that it is safe,
Right.
but in fact, nobody pay attention to it, right?
Right.
And then the other thing is don't ever, ever go swimming alone, especially in open water, even if you think that you are the best swimmer there is. I don't know if you know, over the weekend in Corona del Mar, there's an adult swimmer went missing, 48 years old. I assume that he was swimming alone by himself, and the Coast Guard called off the search after over a day of searching in a large area, and they couldn't find him. So my heart is out for that family, but that is the lesson for us, that really you should not go swimming alone. And then if you're not a very good swimmer, you should always have a life jacket on. Is that fair to advise people?
In open water, certainly, on boats and in open water, rivers and lakes and things like that, you should always have a life jacket. Life jackets save lives. In the ocean, I know we know that surfers aren't going to put on life jackets,
Right.
but yeah, you know your swimming ability at the ocean, and if you can, swim near a lifeguard tower.
Julie, I want to thank you for coming to our talk show tonight and share your family story. Thank you so much.
Thank you for having me.
I hope that this will give the public a chance to really pay serious attention to this issue as we get closer to the hot weather and what have you. Thank you for the work that you do, and thank you for your organization's effort in really save a life. And Kelly, thank you. I didn't know what you actually do until today, so thank you. I think this
My
is
pleasure.
really important.
Thank you.
And
All great ideas.
yeah, let's get together and do more. If we could just target every single retails out there that have anything to do with the pool business, they need to have a prevention message in this section for the public. So thank you for joining us tonight. In 2 weeks, that would be Tuesday, June 14, please tune in with us. The topic would be men's health, because we're going to be celebrating Men's Health Month. Between now and then, if you have any question that you want to send ahead, please send it to yourhealthmatters@ochca.com. Again, that email address is yourhealthmatters@ochca.com. Thank you for tuning in on this very important topic tonight. So good night, and we'll see you next time. Bye.
Done?